I'm Anthony DiGiorgio. I'm an affiliated faculty at the Philip R. Lee Institute for Health Policy Studies at University of California, San Francisco. I'm also an assistant professor in the Department of Neurological Surgery at UCSF. I operate mainly out of San Francisco General Hospital and Trauma Center. I am subspecialized in neurotrauma surgery, and my research interests revolve around Medicaid and access to care for underserved populations. I've spent my entire career working at county level hospitals and safety net hospitals, and have thus developed an interest in Medicaid policy and safety net. Um, this is interesting to me because I see on a day-to-day basis how Medicaid and Medicaid policies affect my patients. Medicaid is an extremely complex system, and very few people are doing research in this area. So it interests me in that patients often have restricted access to subspecialty services. As a neurosurgeon, I noticed that Medicaid patients have restricted access to neurological surgery, and that's influenced my research in this area. I also branched out into research in other Medicaid adjacent topics, such as 340B drug policy. I've been researching this, and the practical implications are how Medicaid can influence access to care for these patients. So patients in the Medicaid MCO population, there are various different policies that could be implemented to increase access to care for things like subspecialty neurosurgical services, other subspecialty services, post-acute care, pharmaceuticals via the 340B program, et cetera. Practically, this is important as our society needs a robust safety net for healthcare services. Medicaid provides this safety net, and by ensuring that all patients have access to care within the social safety net, we can ensure that there's robust care for these underserved and disadvantaged populations. The Medicaid population typically requires intensive resources to achieve optimal healthcare outcomes, and ensuring everyone has access to care helps ensure those outcomes. My previous work has built upon neurosurgical outcomes in the Medicaid population. I have some studies in how access to care and Medicaid affects outcomes after spine surgery, after neurotrauma surgery, and how Medicaid affects access to care for post-acute care services. My work is going to expand upon those topics, and I hope to come up with some policy suggestions that could help expand access to care and ensure that the Medicaid population has equivalent access to care as all other patient populations, with an emphasis on patient choice and provider access.